In the past couple of lectures, we built a strong foundation in the understanding, analysis, and critique of multiple ethical theories, and we're preparing to head into analyzing ethical dilemmas. And the last step of laying this foundation to prepare to analyze dilemmas is to really look at the professional role in healthcare of analyzing ethical dilemmas. You will be challenged in this course to analyze dilemmas personally for yourself, but also to consider how you would analyze ethical dilemmas professionally. And you may find that your personal response to an ethical dilemma may vary from your professional response to an ethical dilemma. And part of the reason that we have ethics committees at healthcare systems is because of this need to balance your personal worldview, which is very individualized, against the worldview of others, and ensuring that we are producing the best outcomes for the patients. So the growth in demand for technology and the changing demographics here in the United States pose all types of ethical challenges, and we're going to talk about those in the upcoming weeks. Challenges from providing services to fiscal responsibility to specific patient care decisions. Furthermore, hospitals must hire and support competent and compassionate staff at all levels of the organization and in all realms, from administration to support to patient care. The question becomes then, how do healthcare organizations successfully meet these demands and maintain the high level of ethical excellence that is not only expected but required of healthcare organizations? And one way to do this is to rely on the engagement of an ethics committee and look to the ethics committee for guidance and advice when faced with challenges in the workplace. And some of you may have experience working with ethics committees in the past. Some of you may not. As we go through this lecture, I encourage you to reflect on your personal ethical framework and your professional ethical framework, and be able to compare and contrast the difference between personal and professional ethics. You should be able to explain the purpose of professional codes of ethics in healthcare. You should be able to describe the role and the functions of an ethics committee, and then discuss how ethics committees work to address ethical dilemmas within an organization. And finally, identify some of the common challenges that are faced by ethics committees. Both personal and professional ethics influence clinical decision-making. Understanding these values that you have as an individual and the standards of the values that your healthcare profession impose can help you in clinical decision-making and thus improved patient-centered care by you as an individual and also as part of an interprofessional team. So over the next few slides, we're going to compare, contrast, and analyze personal versus professional ethics. If you think back to the very beginning of the semester, we talked about the impact of your personal values on your ethical framework and how your personal ethical framework guides your behaviors and choices within your life as an individual person. This means all aspects of your life, which include your professional role, but also the decisions you are making outside of the confines of your professional role and identity. Your personal ethical framework is often formed early in life, and it's based on your worldview, which, if you recall, your worldview consists of your culture, your upbringing, and your experiences. It is important to note that your profession cannot mandate your personal values. Your personal values, your personal ethical framework is very unique and individualized and intimate to you. However, it is essential that we talk about professional values and ethics because your professional organizations can and do articulate and expect you to uphold specific ethical values when you are functioning as a member of that organization. And so professional ethical values are deliberately selected by your occupation as those values that shape the identity, principles, and founding beliefs of that occupation. These values have high consensus within the occupation on their importance, and you will generally find these within the code of ethics of a given profession. We talk about personal and professional values because clinical decision making is influenced by both of these. You cannot completely separate yourself from your personal ethical framework when you are faced with ethical dilemmas in the professional setting. However, the expectation is that the professional values set forth by your profession's code of ethics should guide your conduct in the occupational environment. However, your personal values will remain important to you, and they do continue to influence your professional practice. So it's very important that you are aware of what your personal ethical framework is in relation to the expectations of your profession. And one of the challenges that often occurs with this is that the values, both personal and professional, that are going to guide your decision making as a healthcare professional are going to be very context based. There is no set and dry answer of, if you have this dilemma, this is what you should do. There's going to be nuances of every single ethical dilemma that are going to pool on both your personal and your professional values. Which leads us to a very important consideration. Your professional values, the professional code of ethics, may not always equate with your personal values. And this is where conflict occurs. And this is where you have to remember that as a professional, while you are functioning in the role of that professional, you do have an obligation to uphold the code of ethics of your profession. You are held to that standard. And in your role as a professional, at the end of the day, your duty is to act in what you believe to be the best interest of the patient. So in your professional role, the ethical decision is not simply based on your worldview. Your worldview may influence what you believe to be in the best interest of the patient, but ultimately you need to be able to ground your decision in the best interest of the patient, which brings us back to multiple ethical theories and remembering that the best interest of the patient is not just balancing autonomy and benevolence, but also considering the patient as possibly a larger group than an individual. And this will make more sense to you as we proceed through the course and apply this understanding to ethical dilemmas. During this course, I not only want to provide you with the skills to become an ethicist and become aware of your own personal ethical framework, but this is a bioethics course. This is a course for healthcare professionals. So therefore, part of this course is helping to guide you through the process of becoming an ethical healthcare professional. And it's very important that as an ethical healthcare professional that you don't lose sight of the common goal of healthcare and healthcare ethics. Healthcare and healthcare ethics are grounded in improving the health of patients. If you are to reflect back to when you entered your profession, I think many of you would find that improving the health of people, caring for people, being part of that journey is what brought you to healthcare, whether it was in a clinical role or an administrative role. Therefore, the codes of ethics across healthcare professions are largely similar. I am not going to require you to read the codes of ethics of different healthcare professions, but I am going to highly encourage you to be familiar with the code of ethics of your own profession. And it's really important that working interprofessionally, that you approach healthcare ethics from this shared understanding of a goal of improving the health of patients. Because if you have that goal of your foundation, it's really going to benefit your understanding of professionalism and professional ethics. And it's going to promote interprofessional ethical practice that is going to impact patient care and patient outcomes. So, how do you become an ethical professional? It's a developmental process. The process begins with memorizing standards, understanding ethical theory, understanding ethical principles, understanding the limits of relying on a single theory or principle, and understanding what the common standards are in your profession. And we've done a lot of that, setting the groundwork in the beginning of this course. The second part of this developmental process is learning to integrate professional ethics with your personal values. And that's what we're going to do in the second half of this course as we analyze specific ethical dilemmas. You are analyzing dilemmas from your worldview, but also from your view as a healthcare professional. And so this process really requires acculturation. How are you going to adapt your ethical framework to your professional code of ethics? How are you going to mesh these two in a way that allows you to lay your head on your pillow at night without being troubled with ethical conflict? And so to do that, you have to be aware of your personal framework. And that's why we do some of the assignments we do at the beginning of the course. And then you're going to have to be willing to adapt the ethical standards of your profession. And you may be thinking, now I'm imposing ethics on you, and I told you I wasn't going to do that. I am not imposing a view on you as an individual. What I am telling you, though, is that you will be held to the standards of your profession. And therefore, you need to know what those standards are, and you need to be able to mitigate when the professional standards may not align with your personal ethical framework. On the previous slide, I discussed acculturation, or the integration of professional ethics with your own ethical framework and worldview. And I'm going to talk now briefly about 4 different models of acculturation, or 4 different strategies that people will employ as they are working to integrate professional and personal ethics. And which model you use, or which model you tend to, really depends on your level of awareness and understanding of your personal ethical framework and your professional code of ethics. The first model is referred to as marginalization. In this model, individuals have a low awareness of their own personal ethical framework. Individuals have not really taken the time to evaluate and analyze their personal value and belief system. They're not aware of how their worldview impacts their conceptualization of right and wrong. Furthermore, these individuals have a low awareness of the professional ethical standards and code of ethics of their profession. Therefore, when they are responding to ethical dilemmas, they aren't aware of how their beliefs or how the profession's stance on an ethical dilemma is impacting their ability to make a decision. They're making a decision, but there's not a higher level of understanding of how did you come to that conclusion? What brought you to the conclusion of this ethical dilemma? And these individuals may not even realize that the decision they're making is an ethical decision. The next model is separation. In this model, individuals have a well-developed awareness of their personal ethical framework. They have a solid understanding of the impact of their worldview. Yet, they fail to identify with the ethical standards of the profession. And when I say they fail to identify, I mean they're not influenced by the standards. They may be aware of the standards and the code of ethics, but they're not using that as a guide for responding to ethical dilemmas. Therefore, with the separation model, ethical decisions are based on personal beliefs without consideration of the professional stance. In the assimilation model, individuals opt to disregard their personal ethical framework. They are aware of their own ethical framework, but instead they opt to completely adopt or embrace the professional ethical standards and code of ethics as their sole ethical framework. Thus, decisions are based solely on their professional stance with no acknowledgement of their personal beliefs. And this can lead to a lot of conflict for people because they feel like they are giving up their personal identity, or their professional identity becomes their only way of viewing the world. The fourth and final model is the integration model. In this model, individuals have a well-developed awareness of their personal ethical framework. And beyond that, they are aware of which aspects of their personal ethical framework are critical. What are the things that they are not willing to flex on? What are the core foundational beliefs that they hold to completely? These individuals have also then adopted the ethical standards of their profession. They work professionally by and in alignment with the code of ethics. Therefore, when asked to respond to an ethical dilemma in a professional setting, they are aware of, they maintain their personal ethical views, but if needed, they're able to set aside these views and not let them influence their ability to remain consistent with the professional code of ethics when responding to an ethical dilemma? Many ethicists would argue that the goal of ethics education and preparation at the graduate level is to help students move towards this model of integration. And as we were reading through the 4 models, I hope you were considering which model you currently align with when performing ethical decision making. And if you aren't using the integration model, how can we get you to that point of applying the integration model? So, how do we get there? The first step in the path to integration is to identify, clarify, and challenge your personal ethical framework. I am not asking you to change your personal foundational beliefs. At no point in this course am I going to require that of you. What I am going to require of you is personal reflection to lead you to an increased awareness of the role that your values and beliefs are playing in your ethical decision making. Are you making decisions based only on your ethical framework? Or are you making decisions being aware of your ethical framework, but also considering other impacts and considering the framework of others involved and considering the multitude of options there may be in ethical decision making? Which means you need to be able to evaluate your personal biases, both your explicit biases that you are very aware of, as well as the more implicit biases, the biases that you may not at first even recognize you have, which only comes from reflection and self-awareness. And this is what's going to help you reconcile your personal ethical framework with your professional code of ethics. And for many of you, you're probably going to find that most of your personal values align with the values of the profession. You were drawn to this profession. Many of you felt a calling to the profession. And it's not because you are completely disaligned with everything that profession stands for. Instead, it is because you have a strong alignment with your profession. But you also then need to consider, is there anything in your personal ethical framework that does not align with the code of ethics of your profession? And then, are there values that you are willing to modify? If there is something that does not align, what makes it not be in alignment? Is it a personal bias that you need to address? Is it a past experience that you need to reflect on? Is it a foundational belief that you are not willing to budge on? And how then are you going to respond when you are faced with the code of ethics not aligning with your personal values? And this is a continuous process of self-examination. The bottom line is none of us will ever be without bias. But the more aware of our biases we are, the more that we are able to address our biases and realize the impact that they are playing and rectify that so that our ethical decision making is not grounded in a foundation of bias. As you reflect, you should wrestle deeply with any personal values that preclude you from performing your professional duties. Can you support this? And there are times when the answer is going to be yes. As a healthcare provider, you are not required to participate in activities that go against your moral or religious beliefs. But you need to be aware of what those activities are before you find yourself in a situation where you are faced with this dilemma. You need to know when you might disagree so you can prepare ahead of time for how you will respond and be able to defend and support your response. Now that we've briefly talked about professional ethics, we're going to transition over to the concept of ethics committees. And this is a good transition because members of an ethics committee are functioning in a role of a professional. When you are on an ethics committee, the focus is not on your personal ethical framework. The focus is on upholding the code of ethics that your profession is being held to and working collaboratively and interprofessionally with other professionals who are bringing forth and coming from the vantage and viewpoint of their professional code of ethics. This does not mean that your personal ethical framework does not influence your professional response. It certainly does. But an ethics committee is an application of your professional ethics. And we're going to dig into that deeper in the next few slides. So, healthcare ethics committees. What is an ethics committee? An ethics committee is an advisory board for the healthcare system that works to provide educational and consultational services to patients, families, and care providers. These ethics committees, a lot of them came about in the 1990s because the Joint Commission mandated that healthcare organizations needed to have some way to process and address ethical issues. The Joint Commission did not mandate that this needed to be an ethics committee, but most healthcare organizations did find that an ethics committee was a very effective method to fill this requirement that the Joint Commission had. And ethics committees, when they first were introduced, were very different than what they are today. When they were first introduced, believe it or not, ethics committees, as our book discusses, were called God Squads. In other words, these committees were the people that were deciding who got hemodialysis because there was a shortage of dialysis machines. And if there was a shortage of equipment, which patients should get the equipment. And so it was really about prolonging life and whose life should we prolong. And in this day and age, ethics committees not only have those type of questions to grapple with, but we're going to look at some of the complexity of the questions that ethics committees deal with. We've already talked about questions at the beginning and ending of life, and this week we're going to look at questions regarding technology and health information management. So, why do we have ethics committees beyond the Joint Commission saying we need something in place to address ethical issues? The purpose of an ethics committee is to facilitate discussion and consultation on ethical issues that arise within the patient care setting. The purpose of an ethics committee is to enhance the patient care team relationship or the family care team relationship. So the ethics committee is someone that can be sought after by the patient, by the family, or by a member of the healthcare team. Their goal then is to improve patient care and patient care outcomes through the recognition of the needs, interests, and the rights of each patient and each participant in the care delivery team. So not only is the ethics committee there to help protect the patient, but they're also there to help protect you as a healthcare professional. So if you are in a situation that you feel is unethical, they can be a resource for you just as much as they can be a resource for a patient or a family member struggling with a decision. Their goal is to cause the least pain and provide the greatest benefit. And you may be thinking, wow, this sounds really utilitarian. And you will see a lot of utilitarian and Kantian theories come out of our discussion this week. What types of dilemmas do they address? They address dilemmas related to morality, to patient autonomy, as well as to legislation.
And I thought I would share an example of when I had to contact an ethics committee. I, for a very brief time, worked in employee and occupational health. And one of my roles in that job was to deal with bloodborne pathogen exposures, which were employees that were exposed to a patient's blood or other bodily fluid that could transmit disease. A lot of needle stick injuries. And what happened is we had an employee who was exposed to a needle stick injury during a code, which is a cardiac or respiratory arrest. Usually when something like this happens, we test the employee's blood and then we get consent from the patient to test their blood for hepatitis B, hepatitis C, and HIV. It's done confidentially and free of cost to both the employee and the patient, but the patient has to consent to having their blood tested. If they do not consent, then we test baseline blood on the employee, and then we do follow-up blood on the employee at 1 month, 3 months, and 6 months to see if they've contracted any of these diseases. In the case with the code, the patient died during the code, and therefore there was some pushback on me that I should allow the blood from the deceased patient to be allowed to be collected for this purpose. And I was concerned about this from an ethical standpoint and a legal standpoint because I did not have consent, and I did not find it appropriate to call the grieving family of this patient. And to add the complexity of it, it was a trauma patient from an accident that was a very unexpected event that occurred, and it was a younger patient. So this wasn't somebody, not that it would make a difference, but it wasn't somebody that even the family was expecting to die. This was a very sudden, tragic event that happened, and I said that at their time of grief, the family did not need me calling, asking for permission to draw blood from the newly dead individual. And there was a lot of kickback. And as the person who authorizes and placed the order for the blood draw, I refused to place it, and instead I called the ethics committee. And I got the ethics committee involved because there was argument of doing implied consent, and I did not feel implied consent was appropriate. As I discussed, contacting the family was not appropriate. And in my opinion, if the blood was drawn without consent, it could be considered mistreatment of the newly dead, or mistreatment of a corpse, depending on where you read your literature. And so the ethics committee got involved, and it did kind of get ugly. There was not an agreement on it, and actually, against my better judgment, there was one member of the ethics committee who did feel that they should call the family, and the family got called. But from my standpoint, I felt like I was supported in the sense that I was not making a decision on my own. They did not force me to do something that I was morally opposed to do. Somebody else took that over. And while I may not agree with what the outcome was from my beliefs, I at least had someone to turn to when I was pushed and asked to do something that I did not agree with or that I did not think was ethical. So I hope that kind of gives you a brief example of what an ethics committee is and when and how they can intervene for you. For patients, a lot of times they will be called to help somebody with a living will or an advance directive, or if there is somebody who the family is not sure how to proceed with their care and there is no living will or advance directive, the ethics committee may be called in as well. They also can be called in to do education for groups of patients about developing living wills, about developing medical power of attorneys. That's a lot of what you see them working with as far as education is around end-of-life decision-making. And sometimes they'll provide very general information about different ethical theories and principles and decision-making. So just to kind of give you an overview. As important as it is to know what an ethics committee is and does, I do believe it is equally important to understand what an ethics committee is not and what an ethics committee does not do. The ethics committee does not replace the patient or family and care team relationship. They are there to help enhance the relationship. However, they do not become a middleman between the patient and the care team. They are going to work collaboratively with the patient and the care team. They do not have surrogate decision-making authority. So that being said, the ethics committee does not have the ability to make these decisions regarding patients that can't make a decision for themselves or where the family does not want to make a decision. They can help guide people to decisions, and they do help guide policy and procedure development and guidelines. They review policies and procedures for healthcare organizations. However, they don't have that surrogate decision-making capacity for individual cases. Similarly, they are not the decision makers. The ethics committee is not who's going to say what should or what should not be done. In my case, I would say they might have overstepped those bounds a little bit in the decision that ended up being made, but they did work closely with the provider who was treating the employee that had been exposed to blood to make that decision. So the ethics committees were a resource that helped others through the decision-making process. And in my case, it did bring to light more information about how the newly dead should be treated and about what is considered appropriate care and what is considered to be violation of the rights of the newly dead, and what if blood had already been drawn for other purposes but wasn't needed? Could we have tested that? It brought up a lot of new questions that the ethics committee then started to look into. So while they're not decision makers, they are a great resource, and they can help guide policy and procedure and recognize from events where policy and procedure may need to be put into place. So what does an ethics committee look like? Structurally, the challenges for healthcare ethics committees. So in general, what are the challenges that these committees face? And ethics committees face a lot of challenges, and that's why it can often be hard to find good personnel who are willing to join an ethics committee and who are qualified to join an ethics committee, because many people feel incompetent to join such a committee because of both the depth and the breadth of knowledge that you need to know, as well as a background in understanding some general healthcare terms. So, ethics committees address ethical issues that go beyond patient care. And while most of these issues connect on some level to patient care, in this day and age, most of the issues are not as straightforward as do we withdraw life support? And not that those are straightforward, but the committees could really say this is what we focus on. We focus on allocation of healthcare resources. We focus on end-of-life decision-making. But as we're going to learn about over these next few weeks, the issues that committees have to address are so broad. There's technological concerns, there's financial concerns, there's spiritual concerns, there's biological concerns. And so really, you need a knowledge that addresses more than just a basic understanding of human development and life cycle. Another challenge is this shift in healthcare from treating the sick to preventative care and population health. Historically, healthcare was about treatment and cure for the sick and injured. And now healthcare follows more of a population model, and this model of primary, secondary, and tertiary prevention of what can we do to prevent an event from happening. Primary prevention. Things have started to happen. What can we do to prevent it from getting worse? Secondary prevention. And then something significant has happened. What can we do to rectify it and prevent it from happening again? And that's a tertiary prevention. So we're trying to, instead of treating the ill, we're trying to keep people safe and healthy. And that shift in focus is a shift in mindset that people have to adapt and develop. And additionally, there's these challenges of providing advice on the evidence of evidence-based practice and new and evolving technologies. So there's really this level of commitment to knowing what is best practice, what is going on with these new technologies, what are the nuances of this. So there really is a commitment not only of your time, but of your ability to stay up to date on different types of information. So I've been talking in a lot of broad generalities about the challenges that healthcare ethics committees face. So I thought it might be helpful to highlight some examples of these challenges. One of the big challenges that healthcare ethics committees are facing is the quality of care that needs to be provided to the baby boomers. And this is referred to as the 2030 problem. And the concern is that will there be enough care available for the baby boomers starting in 2030 and for the next 30 years? What's happening is when the baby boomers after World War II were all born, there was this influx of people, and a large portion of them went into jobs working in healthcare. A lot of nurses, if you pay attention, are from this baby boomer generation. And there was actually a time where nurses were what we call a dime a dozen, for lack of a better word, because there were so many nurses as baby boomers when these women were younger after the war. It was something that they could really do to support themselves, support their families. And nursing has classically been one of those very stable professions for people to go into. So there were a lot of nurses. As these people are aging out, there is this concern that we're not filling the gaps in healthcare, and even with doctors and providers as well, we're not filling these gaps from as the baby boomers retire nearly as quickly because people aren't having as many children. Our country is aging much faster than the number of young people. And while America used to be considered a country of the young, we're now looking more at this as a country of the elderly. So as our labor force in healthcare is decreasing, our patient volume is increasing. Not only because of age, but also because people are living longer and with more comorbidities, so more illnesses and disorders, because there's different treatments available that are allowing people to live with these disabilities and disorders and illnesses. And so there becomes this financial strain on an organization who has less staff and more patients with higher acuity and higher needs. And the question becomes, with limited finances and limited personnel, how do we provide the quality of care to these individuals that they deserve? What can be done to provide quality of care? And where do we draw the line? Where is it appropriate to make cuts financially, or where is it appropriate to say that, okay, we can use somebody with a lower level of education to help fill this role or fill that role? How do we respond in an ethical way that is still providing high quality care at an affordable cost? The other example, which is similar to the topic that I discussed as my personal experience exemplar, is the right of the newly dead. And a topic that's really been coming up more frequently in ethics is not only the duty to respect those who are alive, but to respect those who are newly dead as well. And how are these individuals being treated after death, especially with different views about death and what that means? And is this still a person? Is it a body? Has the soul left the body? What level of respect is required for this individual? There are some places that do have concerns regarding the location of the morgue. And if the morgue is right by the dumpsters, what type of precedence is that setting? And what level of respect is that demonstrating for people? And even the care of the body, the post-mortem care that's done, and how the body is transferred from the room to the morgue. And then there's a question of what to do with the final disposure remains of the unclaimed. And often this is the unclaimed, such as somebody who was maybe in the justice system in prison who does not have any next of kin, any relatives, a John Doe that nobody can figure out who this person is and nobody has claimed. And sometimes these are even like John Doe individuals that are homeless individuals that die. What do we do with the body? Who is responsible for disposing of the body? How should it be disposed of? Should the body be cremated? Should there be a mass grave, an individual grave? How do we label the grave? What do we do? And then there's also the concern for the respecting the role of the funeral director and recognizing the funeral director as a member of the healthcare team. And this is also another concern that comes up, is this ability to interact and interface between the healthcare team and the funeral director, who many have argued should be part of the healthcare team. So the ethics committee may be working to help with that interaction, because sometimes the funeral director, the local funeral director, is called as a way to push some of these issues off onto that person instead of working collaboratively together. And this brings us to the close of the first part of our course. The foundation of theory has been built. We have discussed what is ethics. We have compared ethics to bioethics. We have evaluated, analyzed, and critiqued the foundational ethical theories that are used in bioethics. We have looked at individual ethical frameworks and discussed where your ethical framework comes from. We have compared personal and professional ethical frameworks and then applied those to the role of being a member of an ethics committee, which is a role that some of you may one day find yourself on, and a role that you will be much better prepared to uphold now that you have a foundation in ethics. As we move forward in this course, we're going to work on the second part of developing yourself as an ethicist, and we're going to apply what we have learned to specific ethical dilemmas that you may face in the healthcare arena. And as we approach these dilemmas, I encourage you to keep an open mind in your discourse with your peers. Consider your personal response. Consider your professional obligations. Consider your obligations to yourself, to God, and to your patient. Congratulations on your hard work and effort. I thank you for your dedication to self-reflection and personal growth, and I look forward to the next part of this course with you.